Hi, everyone. I'm Steve Kepp, the co-founder of From Day One, our forum on corporate values. Welcome to today's webinar. We're excited about this topic in which we're looking at how employers can increase access to healthcare for all of their employees and address social determinants of health that may present obstacles to equitable care. But before we get started, I want to share something special we have for today's attendees. One of our monthly virtual conferences is coming up on Wednesday, March 9th, and it's titled Enhancing Total Rewards to Fit the Workforce's New Expectations. This will be highly relevant and we believe useful for employers who want to know which benefits and features are most important to workers in this post-pandemic era. Thanks to our partners, including today's sponsor, we have some complimentary VIP tickets available for those who joined today's webinar, and that is you. I'm putting a link in the chat space now. This is a good one to take advantage of, since the regular price for our conference tickets is $149, and this link will give you a free VIP ticket for the whole day's activities. Now, today we'll be exploring the topic of making healthcare more inclusive for all your employees. Even within one organization, employees may have uneven access to healthcare. This disparity can hamper their physical and mental well-being, as might factors of income, education, geography, and other social determinants. Today, we'll be exploring how employers can ensure the healthcare access they provide is equitable and personalized. That includes helpful benefits navigation, care coordination, and new tools such as telemedicine. And we'll be talking about what companies can do to mitigate the crisis of deferred care that's been caused by the pandemic. Our sponsor today is Quantum Health. I'll tell you a bit about them. Quantum Health is a healthcare navigation and care coordination company that delivers an unparalleled consumer experience for employee members, as well as validated claim savings and high satisfaction rates for employers. Quantum believes nobody should navigate the complex healthcare system alone. Their proprietary real-time intercept model identifies opportunities for early intervention in an employee's healthcare journey, which drives cost efficiencies and improved engagement. Since 1999, Quantum Health's model is based on deep consumer research and the insights from working with hundreds of companies and guiding millions of consumers and their providers through the healthcare and benefits journey. Now, a few quick logistical items. This webinar is being recorded and will be available on demand soon after the event, so you can look out for an email with a link in about 24 hours. That email will also have info on how you can get professional development credits for this session from both the Society of Human Resource Management and the HR Certification Institute. And look out for a written account of the conversation on our website at fromdayone.co. Now, for you participants, about 45 minutes into the webinar, we'll have a Q&A session. You can submit your questions anytime you think of them using the Q&A button at the bottom of your screen. Now I'd like to introduce our MC for today, our most experienced and esteemed moderator, Lydia Dishman. Lydia is a staff editor for Fast Company, who's an expert on topics that include leadership, technology, and the workplace. Lydia has also written for CBS Money Watch, Fortune, Popular Science, and the New York Times, among others. Okay, Lydia, take it away.
Thank you so much, Steve, and thanks everyone for joining us today. As he said, this is a very important and timely discussion. If you've tuned into any of the discussions I've led before, you've probably heard me make the business case for diversity. We know that companies that have a diverse workforce that represents the population they serve do better across many measures, including the bottom line. But when we think about inclusion, we often put it into the box that is the DEI practitioner's domain. The thing is that healthcare benefits too can go a long way to making individual workers feel like they belong in an organization. And with so many companies focused on hiring to diversify their teams, it seems as though the inclusion part of the equation, which would lead to greater retention, is missing. It's one thing to get new hires from non-traditional backgrounds and underrepresented groups in the door, but it's quite another to encourage them to stay, be engaged, and do great work. Sometimes that could boil down to offering more inclusive healthcare benefits. And for those of you in the audience at organizations with more limited resources, there are still ways to make this happen. And sometimes it's a simple strategy like making sure the list of healthcare providers that you are offering to your workforce details race and gender, for example, so that workers can feel comfortable choosing the right provider for them. So to discuss these and other best practices, we've assembled a group of professionals who are eager to share their insights. I'm going to ask that they introduce themselves, tell us very briefly about their work, and also answer a little bit about their own experience over the past year to maintain their own health and well-being. Jeris, let's start with you.
Thanks, Lydia. Nice to be speaking with everybody today. My name is Jeris Stueland, and I'm an associate partner with McKinsey Company in our Minneapolis office. And I lead all of our work related to employer-sponsored healthcare, in particular mental health care and health equity for those with employer-sponsored insurance. So excited to be speaking with everyone today. I think it is, we were talking a little in the waiting room, it's very cold in Minnesota the last few weeks, as Timothy and I know, but over the last few years, I think one of the nice things about COVID is I have gotten outside and gone on a lot more walks when it is, above freezing. So I've been excited about that.
Nothing like a good walk, especially at the end of a workday, to improve your mental well-being. I know that I have been out in all kind of weather doing that every single day. Mike, how about you go next?
Thanks, Lydia, and it's a real pleasure to be with all of you. Good afternoon, everybody. My name is Mike Sokol. I'm the Senior Vice President for Clinical Strategy at Quantum Health. I'm a physician. My background is in preventive medicine, and I've been with Quantum Health for a little over 3 years, and I help look at all the different clinical programs that we provide to our clients who are self-insured employers, and making sure that we're taking a population health perspective in what we do. Really excited to be talking about this topic of DE&I and social determinants of health and the impact that it has. And I can tell you, Lydia, from my own personal experience, even though I am a physician, I find that I've struggled a little bit in the past couple of years with COVID and focusing on my health, and particularly with the preventive care. And so that's one thing that I'm really trying to catch up on now, is making sure that I'm staying up to date with all the recommendations. I went to the dentist recently. I usually go every 6 months. I hadn't been in 2 years, and I think they were going to charge me a double copay for all the buildup that was on my teeth. And so, I'm getting back to good dental care, and it's actually, not to get too personal, but time for me to get my colon cancer screening. And so need to focus on that, and hope that everybody is doing the same with their preventive screenings. Thank you.
Preventative care is a part of healthcare, so that
Exactly.
is super important. And you're starting to sound like the cobbler whose children have no shoes.
That's right. Exactly.
Take care of yourself, sir. Joanne, tell us how you're doing.
Well, hopefully, I hope everyone can hear me. I've been having some technical issues. Am I good? Okay. I am Joanne Hill. I am the Executive Director of Diversity, Equity, and Inclusion at Piedmont Healthcare. 2.5 years into this new role, the first person hired by Piedmont Healthcare to work on establishing the strategy for diversity, equity, and inclusion at Piedmont. What I will say is, having been in corporate America on the profit side at Aflac for almost 29 years, where I retired to going to Piedmont, and then 6 months after starting, here comes COVID. It's been an eye-opening experience. But what it has shown me more so than anything is that the health disparities that have always been there are just more obvious now. And I think it's an opportunity for each and every one of us in our organizations, our country, and the world to really lean in to try to look at the equity that's so needed in healthcare. For my own personal mental health, like Jeris, long walks, love yoga, really focusing on being the best person that I can be. And I think this pandemic has given me the opportunity, as I've seen loved ones and friends be impacted, people pass on, that I want to be here for a while. And so I need to make sure I take care of me. Self-care is not selfish. That's my quote.
100%. I co-sign that. Self-care is not selfish. And especially if you in the audience are like me, sitting for a large part of the day is terrible for your back, even if you do have good lumbar support. So yoga, Joanne. Last but not least, Tim, the other one from the frozen tundra.
There we go. Thank you, Lydia. Tim Leier here. The last name is pronounced Leier, but I promise I'll keep my comments to facts to the best of my ability. Happy to be here from St. Paul, Minnesota, where we are nice and cold, but in a little bit of a warm streak. We're going to tap 30 degrees today. I lead our international benefits for Ecolab. Excited to share with you some thoughts about how we recognize that in diversity. In terms of wellness for the past year or 2 years, I'm an asthmatic, and so I'm particularly keen on keeping my physical distance during the pandemic. Coming down with COVID is nasty for me. We've dealt with it, and it's not fun to say the least. But I think one of the things I've really focused on, remembering that it's physical distancing and not social. And so finding a way to be social, even in this time where we do have to be physically distanced, is critical, both for my mental sanity, obviously, but also just for general well-being, so that you don't get into a lump of sitting in your house, becoming too sedentary, all the things that people have shared. So I think there's plenty of ways we can keep that in mind as we continue to come out of this pandemic. Thanks, Lydia.
Thank you. Yes, and it cannot be overstated that we are humans and we need to be around other people. And maybe that is just on a Zoom screen, but the interaction is so important to mental well-being. So while we're talking about all of these things that we're doing for ourselves, let's talk about what's happening within your organizations and how you're measuring health and well-being of the workforce. And did you have metrics in place before the pandemic? I know that the focus really has been since March of 2020, but what's changed and how are you adapting? Jeris, let's start again with you. We'll go around.
Sure. Well, I think what we've seen in organizations we've worked with is I think there's been a shift to more, broadly more people-focused metrics as opposed to financial metrics over the last 2 years. I think, historically, I think a lot of the organizations I worked with on their benefits or, broader kind of health supports for employees, there was always this focus on how are we managing the funds? Certainly we want employees to be healthy. We want them to feel rewarded, but we want to make sure that we are, getting the best outcomes we can for each dollar we spent. We want to make sure that is, driving value and utility for our employees. And I think what we've seen over the last 2 years is, one, organizations say, yes, that still matters. The dollars are still there, but, one, we are just more concerned about health. And we just want to think about health in a different way. And how can we keep people healthy if we are asking them to come into the office at all? How do we make sure they feel healthy? They aren't coming in when they're sick. And then I think also, there has been a bigger focus on mental health and health equity, as I said. And so, many more employers saying, I am concerned about costs, but when I'm addressing my employees' mental health, when I'm thinking about that, or when I'm thinking about, supports for social determinants of health, that I'm going to think about in sort of a separate set of metrics from costs. I'm going to think about how many employees am I supporting in terms of mental health outcomes, how many, employees am I supporting with social determinants of health. And we even in a recent survey we did, supported this kind of anecdotal feeling I've had of, we had 20% of the employers who responded to our survey saying, I don't expect any ROI on the wellness and mental health programs I support for my employees. I'm doing it just for an experience and employee support perspective and not trying to measure a financial ROI.
That had to be a big shift in leadership mindset for sure, because we are so used to having those quantifiable metrics. So I'd like to come back to that a little bit later on in the discussion. Oh, Joanne's back. Okay. While we're waiting for her to fully connect, Tim, why don't you tell us what's happening at Ecolab?
Yeah, you bet. So one of the things that Jeris mentioned that I want to hit on is the anecdotal, right? We've often talked about the metrics, and they're critically important. I'm not going to dismiss them. But thinking about those anecdotes and remembering that a lot of what we've got to do, especially when we're distanced, is listen to each other, find avenues, conduits for our managers to hear what our associates are saying so that we can factor that in, because it feels too often that if we wait for the metric, we miss the opportunity. So we know that wellness is a hot topic right now. I mean, it has been, but as we come out of this pandemic, it's been a particularly hot topic. And instead of waiting for the metrics to show it 3, 6, 9 months down the road, we were getting that real time, especially as we consider what the next 3, 6, 9 months are going to look like. And part of that was making sure we had more availability to resources for our associates as they face this transition that we're going to be coming into. So I think the anecdote, hard to metric, hard to measure, but also a critical component for telling us how to change our behavior.
Yeah, well, if there's anything that we've been doing over the past almost 3 years now is changing our behaviors, whether we've liked it or not sometimes. Joanne, do you want to go next? Tell us about how you're measuring the health and well-being of the workforce and if that's changed.
Absolutely. Hopefully you can hear me now and you can see me. Hey, I'm on my phone. We're going to make it work.
Yeah, that's totally fine. We're, almost 3 years in, we are completely used to technological glitches. Grace and patience. Go for it.
Well, it was amazing when I joined Piedmont that we actually had a department called Employee Wellbeing, because I did not see that in my previous companies. And so there was always a focus on what are we doing to understand how our employees are doing, what they need to do. But I think what happened with the pandemic is we saw just how critical it was frontline nurses and people passing and people getting COVID, so that we started actually tracking that, having our employees go into the portal so that we could note how they were feeling and being more direct, even on our Great Places survey and pulse surveys, asking people, how are you feeling? What do you need from us? I mean, I'm a strong proponent that you move what you measure. And we're even continuing that as I hope we're on the other side of the pandemic to be more in tune by listening and asking our employees, how are you doing today? What do you need? And what can we do to help support you? Absolutely.
Yeah, I think that the pulse surveys have gotten a lot of use over the last couple of years, for sure. And Mike, this is a slightly different question for you because you're seeing this from both your organizational perspective, but in terms of broader trends, what are the biggest concerns that workers are expressing about health and well-being right now?
Yeah, so I would really echo a lot of what Jeris was saying, particularly in the area of mental health. Things that we saw amongst our client population, the members that we serve, was that in the past couple of years, there's been a great demand seeking and getting support for mental health related issues. And a lot of that really was related to COVID, people being stuck inside, not being able to do their normal routine, having a lack of social interaction in person with people, just, doing their common routine. And so we saw a huge spike in telemedicine, for example, on people trying to access behavioral health that way. We spent a lot of time helping our members to navigate, to get to like EAPs, for example. And it's really good to know that the employers on this call and almost all the employers that we deal with really have very good programs in place to help address mental health issues, providing EAP, providing benefits to get people to the right provider. And so that was one key area that we saw. And as I mentioned with my own personal experience, Lydia, we did see a huge drop in people getting their preventive screenings over the past couple of years, but also even, just as concerning, if not maybe perhaps a little bit more concerning, was people with chronic conditions. So Timothy, you mentioned you have asthma. We saw a number of our members that have asthma, heart disease, whatever the condition might be, not really getting the care that they should be getting. Diabetics not getting their A1Cs checked, or people getting their routine visits with their physicians. And so part of what we've been able to do in the past few months is to make sure that we're re-engaging members to make sure they understand the importance of managing their chronic condition. And so it's getting people back into the example of doing the preventive screenings, which we know is so important, and getting people to the right resources for mental health. And so the good news is that I think we've seen a nice comeback there. And we also measure these items as well, Lydia. We do look at financial outcomes, but also to Jeris's point, we look at clinical outcomes. Are we helping to close gaps in care, for example, for people with chronic conditions, and also humanistic outcomes? Are we improving quality of life? Are we seeing more satisfaction and engagement with people in taking care of themselves? So the good news is that I think we're starting to see a rebound, getting back to normal. And I hope that hopefully this pandemic will soon be behind us and we can, move forward and get to where we need to be.
From your mouth to
right.
You mentioned something now both times about deferring care. And so that kind of leads me into another question that I had about helping employees who have deferred care. And Mike, you mentioned communicating the importance of it.
Yes.
But for the rest of you, are there any other best practices that you're using to make sure that people can kind of get back on track with preventative care? Nodding vigorously, Tim?
Yeah, so and I definitely think that if we can find an opportunity out of the pandemic, it's to tap some of the new practices that we've found that we've maybe used more during the pandemic as best practices. Telehealth comes to mind right away. I mean, I can tell you as an asthmatic, I wanted to visit my doctor. Best way to do it is for me to grab my peak flow meter at home, get on the phone with him, have him watch me to check that out. We also have heard from some of our associates that need some mental health assistance, that doing so in this pandemic time via telemedicine was easier. Some of the stigma of pulling your car up to that clinic is gone. So I think there's an opportunity that we can focus on what we've gotten that's great out of this, which is telemedicine, opportunity for more flexibility. Maybe we can hold on to that and we can use that to couple with everything else and make it a positive going forward as well.
Yes. And you've all heard me say this a million times before, never let a crisis go to waste. Jeris, you wanted to add? Joanne, I'll come to you next.
Yeah, everything Tim said, I love all of that. And I think, in particular from sort of the diversity, equity, inclusion lens, the few ads I'd have is, there are some employers we've worked with that have completely agreed on the telehealth angle, and they recognize that, there may be some employees that don't have a quiet space at home when they can engage in that telehealth, right? Or may not have the time at home to do telehealth. And so we've seen some employers that are, even building sort of quiet private spaces in the office, right? Like a virtual clinic even, or even just a room with a computer employees can use to go have their telehealth appointment when they're at work. I think that totally, as you said, reduces the stigma, enables employees to, fit those appointments into their day, and, provides them the private space so they don't feel like they have to have that telehealth appointment in a cubicle farm or in, a crowded apartment while they're trying to do childcare as well.
Yeah, if there's ever a reason not to take care of a doctor appointment, is because you're sitting elbow to elbow, let's say in a call center or in a warehouse or something. Joanne, your perspective on this is going to be different because you work for a healthcare organization, but what are you doing for employees who have deferred healthcare? Have they?
We have had some employees who have deferred healthcare, but I think even more so what we have found in the midst of this pandemic is that there needed to be more education across the board on why is preventive measures so important. One of the things I like to tell people, being an African-American, obviously, that for many, many years, we know that there was a myth through Brown and Black communities that for men with prostate, they were afraid to go and have that physical exam, not having the knowledge that you don't necessarily have to have the physical exam. That can be accomplished through a blood test. How do we get that information to people so that when people come into our healthcare systems, they're not at stage 4, they're not in the need to have a major heart surgery? So one of the things we notice is even with the reluctance of ethnically diverse people with getting the vaccine, there needed to be more education. I mean, I live in Columbus, Georgia, right next to Tuskegee University, which is 45 miles from my house. So here, where Piedmont is headquartered in Atlanta, there were people who were skeptical. We had never really addressed with people what happened with the Tuskegee experiment. I mean, one of the things I think we have to do to move the needle is we have to be more courageous to say there were things that happened in history that are still in the minds of people. So we've changed our lens to be more community focused, working with our elected officials, with our churches, with other organizations, so that when people come to us, they'll be comfortable and more willing to get that preventative care.
Yeah, I'm really glad you brought that up, because I was thinking about the larger question about communicating offerings to people who may have been historically resistant. And I'm not just talking about race and ethnicity, but I'm also thinking about in terms of mental health, for a certain age group of people that, preventative mental health care did have a stigma, like, oh, you're going to a shrink, why, and that was very valid way that people were thinking once upon a time, not so much anymore. So what are some good ways to communicate these offerings to people who may have feel like, certain things are stigmas? Jeris?
Yeah, I think the stigma and the, lack of familiarity with or just not, having the education about the healthcare is important. I think it's also important to recognize the history of there are many employees that don't have a history with employer-sponsored health insurance, whether because they're immigrants or because they grew up in families that, the parents didn't have employer-sponsored health insurance. That type of education is really important for employees as well. What we saw was that, for a significantly higher number of employees of color, as well as LGBTQ plus employees, the tools and the resources employers provided to help employees navigate the healthcare system were not as helpful. And so ensuring that those tools and resources sort of, start at, let's not assume people have experience with the system. Let's not assume people, know that their employer insurance covers visits to the eye doctor or covers visits to a retail clinic. Like, let's start the education at that point. And then let's also, as you mentioned earlier, Lydia, let's make sure that the tools and resources can help people navigate to the providers they're looking for at the beginning, whether that is providers who have experience with LGBTQ plus issues or with people of color. I think one of the things we also saw in our research related to stigma was that employees of color and LGBTQ plus employees, they already felt more stigma when taking time off to visit healthcare providers, because if you're working in a sea of white men and, you're a woman of color, you feel like people are going to notice when you go to the doctor more. And because those employees don't have tools that are as helpful to help them navigate the system, they have to make more visits. And so the stigma just gets sort of piled up on. And so really those tools and resources and doing what you can to reduce that stigma through a change in employer culture is really important in advancing healthcare for all employees.
Does anyone want to add to that, Mike? Before
Yeah,
I go on to the
would.
next question. Go ahead.
Yeah, I appreciate that. I think Jeris brings up a number of important points, and Lydia, a couple of things. First, I think in terms of engaging people, I think we have to have multiple means to do it, right? So I would say that for the employers that are listening in and have vendors, whoever it might be, making sure that there's a multi or an omni-channel approach. Some people like to talk on the telephone, some people like to text, some people like to email or use secure messaging or use an app. And so I think one of the things that we've been very cognizant of is that we have to have a number of different modalities to be able to communicate with people, reach them where they are. And I think also to Jeris's point, I think a lot of this has to do with being very proactive, right? Not just waiting for people to raise these questions, but know that there's a caring person that understands these issues that can help address it. So in terms of what we do with navigation, we make sure that when we're having conversations with members, rather than just waiting for them to bring something up, we will often ask these types of questions, particularly in the whole area of social determinants of health, making sure that we understand, do they have transportation? Do they have access to healthy food? Are they living in a safe home environment? What are the things that we can do? So helping to identify any of these barriers and then being able to locate either federal, state, or community local resources that are available to help support them. Again, to Jeris's point, one of the things that we've seen in the last couple of years, particularly in the LGBTQ plus community, There's been a lot of issues in the transgender community. Members that are transgender that are trying to find a provider that's accepting and supportive of the transgender community. So we partner with an organization called WPATH, the World Professional Association for Transgender Health, to help identify and find those providers. We have members that are going through gender affirmation surgery, and we have nurses that are speaking with them in a very caring and an understanding way that we know what they're going through and providing support there. So we want to make sure that for all the people that we serve, that we're being proactive and using various communication channels that will work best for the individual.
I was also thinking about those without as much access to technology. And I know that there are attendees out there who do have workforces that are either in manufacturing facilities or warehouses. They're not at a computer all day. So, Tim, your suggestions?
Yeah, absolutely. And I think that goes to the point, right? Diversity is not just race, color, gender. It's also where you're working, how you're working. Age can be a factor. Sometimes I'm called a Luddite, even though I spend most of my days on a computer, but I don't necessarily go to my cell phone as my first mode to get the answers on this. And I think thinking proactively about that is really critical. I mean, the comment of understand at some of our plants and our warehouses, getting something out in paper can be even more critical than making sure we've got an app for our field sales and service workers that are going to be, wrapping up at a client. They want to do a quick note on their mobile to get ready for what they're going to do later, versus those with computer. And then also, and a large part of my responsibility is international. So one of the other things that resonate is, let's make sure we think about the circumstances that folks are going to encounter based on the geography that they are. So the way I handle LGBTQ issues in Saudi Arabia and Russia are tremendously different than the way that I handle them here. And that's an easy example to use on the phone because it's, I think, obvious to most folks. But there's these subtleties that don't at first come to mind. If I'm dealing with our facilities in Roscoe, Illinois, and Beloit, Wisconsin, they have a very different set of circumstances than what I've got in New York City as well. And so I think going through that and making sure that we're listening to the associates and their managers and talking to folks in those local communities to know how we respond helps us do a better job of communicating it, merchandising the offerings that we've got available so that we make sure people can access them appropriately.
Yeah, I'm thinking about that now that you're talking about it. And yes, you have to look through almost a kaleidoscope instead of a lens to get to all of the different levels of diversity that you would have in a regular workforce. But I'm thinking about it in terms of a lot of organizations trying to personalize benefits. And you have all of these individual experiences, lived experiences, needs. How can you personalize offerings to make people feel like they're getting exactly what they need? Go ahead, Tim, if you're ready to jump, and then Joanne, you can go next.
I'll jump in. For me, it's being willing to share my own personal experiences. If you've got folks that are willing to open up, right? I'm an asthmatic. I've shared that. A year and a half ago, I got diagnosed with an autoimmune disease. That one hit me, gobsmacked me. But being willing to talk about it and let others know, hey, you're not alone in the journey, even if you don't know what it was. It took me a year to figure out with doctors what it's going to be. And I think having folks that are willing to share that and understand that it's not detrimental to your job, do your job, take care of that aspect of it as well, and personalize it is really powerful, especially right now. But I think, again, hopefully that stays the case going forward.
Joanne, personalizing?
Personalizing is so important. I say this often. If you really want to know what Joanne wants, you need to ask Joanne. Asking my husband, asking my sons, my sister, it doesn't get to what Joanne wants. And I think in our organizations, we have to ask people what they want. I mean, we're all dealing in some form with the Great Resignation, even in healthcare, with people leaving, people coming. And sometimes what will make a person stay is having a benefit that I need. But I have to know that there is no judgment to what Tim said. Sharing is not a judgment zone. But Joanne needs this. Tim has asthma. Joanne does not need a daycare benefit because she didn't have a child in daycare, but perhaps she needs something else. So we've been engaging more with surveys and asking people, but knowing when you ask someone what they want, you have to also be prepared to deliver or acknowledge that I heard you. And I think that's what employees are asking. I want you to hear me.
Mhm.
Jeris?
Yeah, I couldn't agree more with all of that from both Tim and Joanne. I think on the sharing experiences, I think it's also important to have employees that look like lots of different types of people, right? Sharing their experiences. So having leaders of your DRG groups or having, diverse leaders share their experiences, open up about, what types of healthcare benefits they've been able to make use of, what types of healthcare experiences they've had, I think is really important because it just helps the employees see that they could do that to reduce that stigma around, utilizing health benefits. And I think on listening to employees, absolutely. I think it's when we listen to employees, we learn that assumptions we may have made might be wrong. So I think that's really important. I worked with an employer that was in rural Wisconsin, and I think their benefits team had long assumed they needed to have a very broad network because otherwise employees would have to drive too far to get to a healthcare provider. And when we actually did focus groups with the employees said, look, I live in rural Wisconsin. I have to drive an hour to get anywhere. Like, I don't mind driving an hour.
Even to the grocery store.
What really matters to me, actually, what they told us was mental health benefits. And they wanted better mental health benefits. That was a real pain point for employees that the employer hadn't recognized. And then once we heard it, the employer was able to put in a new EAP solution for them. And I think also when we listen to employees, as Joanne said, recognizing that one solution is not going to work for all employees. Yeah. So we've looked at employers trying to help employed parents manage through the last 2 years, right? For some employed parents, having a backup childcare option works. For other employed parents, I remember one of my friends at the beginning of COVID, she said, look, I don't feel comfortable having a new babysitter come into my house right now. So that backup option that my employer is giving me doesn't work for me. I want my manager to work with me to say, how can I make your workload more flexible right now? How can I, help you feel like you can still contribute, but do so in a way that is comfortable and safe for your family?
Yeah, absolutely. Mike, you wanted to add?
Yeah, so one thing I wanted to add as well, and I echo everything that my colleagues have said, is that sometimes we find as well with certain individuals that they may not be as willing to share their experience or talk about the challenges that they're facing. So part of it too is being able to really get at the issue with the individual, know that they may not always want to reveal it, and part of it is supportive in trying to get that out. If I could share one anecdote, which I think—
Yes, absolutely, please do.
We have a member that we follow, a gentleman who's employed by one of the companies that is a client of Quantum. He's on the lower earning scale, doesn't make a whole lot of money, just by himself in a house. He has multiple sclerosis, and he has been bound in a wheelchair. And we had noticed that his claims for using a very expensive transportation service, an ambulance service, where we're really kind of going up and up, and on a monthly basis, it was several $1,000s a month, and we were trying to understand, why is this gentleman using this expensive ambulance service to get to the doctor or to get to any follow-up appointments? Why isn't he getting some support there? And it wasn't until we had several conversations with him that he had admitted to us that he had a ramp that would take him from the front door down to the driveway where he could, get into a car with the help of a family member or friend or whatever. The ramp had broken and he couldn't afford to fix it. And he was embarrassed to admit that to anybody. And that's why he was calling this ambulance service to come and get him. And so our nurse working with him, knowing this gentleman well, of all things, in a lot of the research she started doing, actually found a local Boy Scout troop that was looking to do a community project. And she had the Boy Scouts come to this gentleman's house, built him a new ramp, and now he can get down in his wheelchair and get into a car with a family member or a friend or even an Uber. And so it certainly benefited him, but also for the clients that we're trying to support as well. All that money they were spending every month on this ambulance service, basically went away because we were able to fix the ramp. So what we learned is that, when we manage people with their chronic care or their preventive care, the clinical management of course is very important, but it's these non-clinical issues that play such an important role, these social determinants of health. And we have to make sure that we're equally addressing them and making sure that we're working with people, because they may not, again, always be so willing to share their challenges. How do we get to them, get to a solution that's personalized for them and be able to provide that support that they're going to acknowledge and will help them.
I want to unpack this a little bit more because I know that asking, pulse surveying, these are very valuable ways to get at this information. But we also earlier talked about stigmas and misinformation. So let's talk about privacy and trust and what role those play in understanding where people are and what they need, particularly how to go about these conversations to make sure that people feel like they are in a trusted space, that they are comfortable enough to answer. And, maybe it is the matter of an anonymous survey, but maybe it isn't. Best practices, opening the floor. Hand raises, Jeris, she's quick on that button. I feel like we're playing a game. Go for it.
I wasn't Quizball in college. So yeah, I can start with a few thoughts and then would love to hear what others think as well. I mean, I think again, the point about multiple channels comes up. I think you do have to have a way for employees to, learn, find out about benefits, find out about resources available to them, express the need for things through multiple channels. I think, just having a solution that says like, well, you have to ask HR about everything doesn't work, right? Because we've seen, for example, for transgender employees who may not be out at work, it doesn't work for them to have to go ask someone in person about this type of benefit. So I think that's one. I think the other is just the importance of building relationships, right? What we've seen is that like, you can't just jump into that conversation and say, okay, tell me that your ramp is broken and let me help you fix that, right? You have to build that relationship. You have to build that relationship through just building a personal relationship. I think what we've also seen is that, helping folks solve more administrative issues first, right? So helping, show your employees or show your members that, hey, I can actually help you solve that billing issue. I can help, get this rerouted to the right address, like building the relationships through solving some of those more administrative problems. That can then, build the trust and unlock kind of the stronger relationship that can have a conversation about some of these more personal health matters.
Tim?
Yeah, I think also
Okay.
being willing to bring in contrary views, letting there be, I don't want to call it a mini panel fight, but to a certain extent, this medical science, there's an art to it. The other thing, I love right now, there's a political environment where we say you can't question science, or listen, science is about, right, asking a question, getting an answer, coming up with a new question and getting a new answer. And I think sometimes showing folks that that's exactly what we're going through can be a really helpful way to remind everybody that this is okay. So we've had some success with that. I will also tell you, it can be flat out scary, especially when you're in the middle of the pandemic, to let those contrary views stand up, because they might create some uncertainty for a little while, but there's uncertainty too. So I think just being willing to be open with that has been helpful, if not always comfortable either.
Mm-hmm. Yeah, these are challenging times, on a variety of levels, and we've had to have many uncomfortable conversations in order to meet goals. Mike, what did you have to add?
Yeah, I was just really going to echo what Jeris just said, and I'm actually going to offer a job working in our company as well, because she really echoed a lot of what we do and what I was going to say. And
great resignation.
I mean, Jeris is right. People, that gentleman with the MS, he's not just going to open up and talk about the broken ramp. I mean, it took months and months of building a trusting relationship, and that's really what it's all about. And the nurses that we have that speak with individuals, we call them personal care guides. Where they're not, they are nurses, but they're called personal care guides, because that's what it's about. Helping, like you said, maybe with a billing issue, helping with a personal issue, showing that you're there not to deny a claim or anything like that, but to say, I'm here to be an advocate for you and to support you. And I want you to feel comfortable that you can share this with me. I'm not going to talk to your employer about it. It's just between you and I, and really finding that solutions and just really going deep and building those relationships. Another quick anecdote. We had another member, a married couple, older couple. The husband passed away from cancer. the personal care guide had a relationship with the wife, was seeing how she was doing. She had high blood pressure, which she wasn't really managing with all of this. And the nurse was very concerned about that. And because they had this relationship, the woman had admitted to the nurse that she didn't have the money to bury her husband. Can you imagine that? You know, your husband passed away and you're thinking, you know, can't think about taking my blood pressure medicine because I've got to figure out where I'm going to come up with money to bury the husband. And the nurse actually found a local funeral home that was willing to work with her to bury the husband. And, you know, I mean, it was so touching to me. And then, you know, the woman realized that, well, it's not just about money. It's about, you know, care and compassion and sympathy. And so the fact that they had that relationship and now she could focus on her health and taking her medication and so forth. So I agree. I think it's really building those relationships over a period of time, showing people that you care, showing that it's not just about their clinical care, but all these other factors that have such a big impact.
It's just about time to switch over to audience questions. And we do have one that kind of complements the one that we're just answering. And Joanne, I'm going to ask you to answer this one simply because you were talking about the, you know, the racial differences with assuming that people will or won't do something. This question is where does privacy come into play in terms of reaching out to people who might be at risk, but don't like that management is making assumptions about them? What should you do in that situation?
Wow, I want to know who asked that question. That's a great question. I think it still goes back to connections and communication. So my particular role, I am a senior leader in HR. Sometimes people are afraid to go to HR, but at Piedmont, we have different avenues. We actually have chaplains who are not, they're faith-based, but their role is to also be a guide. We have found that sometimes people feel more comfortable going to a chaplain and talking to them about, I have this particular need or something is going on. We also have what we call an employee emergency fund. I'm the executive director of that fund. When people have particular needs, they can come on an anonymous basis. They don't have to work it through HR. We have criteria where perhaps they can get additional funding for an emergency, something that's catastrophic. But I often like to say it's not necessarily the leader who may be the most effective person in getting that out. It's the person that they trust. And in many ways, it may not be the leader. And so I think for our organizations, we have to avail ourselves to let people know that, again, I see you and I hear you. I may not be that person, but there should be someone that people can go to get the help that they need.
Another complementary question. How do you differentiate when a company should take the initiative on various well-being items like MHSA for employees, or when to remove themselves from the topic to create a distinction between work and personal life? That is a challenge. Anybody want to raise their hand, help out with this one? Ding, ding, ding.
Well, I think again, I can offer some thoughts to start, and then would love to hear what others think. I mean, I think historically employers had much more of this, you know, we don't want to get into your personal life. Like, you know, we don't want to, you know, we want to be at work and you have your personal life and we don't want to get involved there. I mean, I do think like COVID and the Zoom era, it broke down some of those walls because, right, like I've talked to employers and they say, look, we're on Zoom, we can see what the employee's living experience or housing situation is like. We can see that there's kids in the background or, you know, pets or loved ones. And so I think some of it is like, we've all had to kind of open up our lives a little bit, and it's just become more apparent. And I think part of that has made employers more comfortable, you know, sort of saying, we can't just have a wall between these parts of our lives. And so therefore we want to be respectful. We want to have the right trust. We want to have the right, you know, person, you know, talking to our employees, but we kind of have to recognize the situation that they're in. And I think the other thing is that, you know, in particular, you know, I think COVID has demonstrated this, but I don't think it's something new with COVID. I think, you know, employers are increasingly recognizing that work the nature of work, the way we work, our operating model, right, is part of what is driving for some employees mental health struggles, right? The feeling of needing to be always on, the feeling of, not being able to, having to bounce back and forth between work and home responsibilities and going back to work and going to home responsibilities. And so I think also just recognizing that, like, it's not just that employers can kind of offer supports for that, but they really need to kind of dive in a little bit and say, okay, how do we actually help change our operating model and, alleviate some of these stressors that are causing mental health challenges?
Tim?
Yeah, I think thinking along those lines, nudges, right? I mean, some people have been using little nudges to get information out instead of the full-on push, which sometimes might feel a little bit too Minority Report, a little too in your face. What I like about the nudges to get it out there is it's just a general reminder to everybody. Think about it. If it applies, we made it available to you, right? We are in this together. We want to make it available to you. And I don't want to be so obtrusive that we say, you got to do this. You got to look at this. It's not my place to know that for sure, but I think the nudges have been really effective in helping us do that on a softer basis. I hope we continue to do that and think that same kind of mindset for other solutions we might have out there.
Mike, you want to add?
Yeah, I would just add real quickly, Lydia and I agree again with my colleagues. I think the more transparent and honest an employer can be with their population as well is really the best. And I found that in my prior roles in a couple of prior jobs. I was a corporate medical director at a couple of large organizations and found that, just being really honest to people about why we're doing this, what the goals are, what we're trying to achieve. At one company, I actually, in an email to the employees, told our population how much money our organization spent in a year on healthcare. I had some executives say to me they had no idea that was how much money we were spending. And it's not just about money, but I was trying to get the point across that, we were providing these really wonderful benefits. And to be really honest, while we deeply, deeply care about people, it's a two-way street, right? The company, I think, has a responsibility to provide these wonderful and generous benefits, but it's also telling employees and their family members that, you have a responsibility to take care of yourself, to manage your health, to do what's good for your family. And so it's really kind of trying to tell people that it works both ways, but being really honest about why you're doing this, what you're trying to achieve, and what the benefits are, both for the employer and the employee. I found that people appreciate that. They appreciate the honesty, and I find that they're more likely to engage when there's more transparency involved.
For sure. Tim, one quick follow-on. One of our audience members wanted an example of a nudge.
So an example of a nudge might be right around the end of the holidays, a common time for mental health to be a problem. A nudge might be a reminder. Up to 30% of people in America are going to experience some level of depression after the holidays. You might know somebody, you might be experiencing it yourself. Now might be a time to ask a question, give a hug, call the EAP. Something as subtle as to just, highlight something that's prevalent at a time that might be particularly relevant and a little bit soft.
Right. Glad you mentioned EAP. We do have another question about EAP here. What role does EAP serve? Sometimes it feels like a Band-Aid. Sometimes it feels like it's harder to direct people to an EAP and explain the services than to just serve them yourself. Thoughts? Hand raise, EAP. Go ahead, Joanne.
I think EAP does serve a critical role. I think we saw that in the midst of COVID. I do think that there again, though, with EAP, there are some people that don't want to pay. They don't want people to know that they need it. So no one will know. Well, if you get 6 benefits and you use them, then somebody knows. But I believe that we are at a critical time in all of our organizations and in our country and our world where we have to be proactive and use what we have and expand upon it to make sure that people have what they need. When I see something on TV and I hear that someone, an actor, just anyone commits suicide, the first thing that people say is, I had no idea. Lisa, she looks like she was just so much had it together. I think it also means that we have to take a little time to step outside of ourselves and to open our eyes to the people around us. We have employees that may go through a change, I think it's our job as leaders to know that. Yeah, I'm a pretty high energy person. I often say with people, it's an antidote, Mike, I'm going to use one, that because I'm high energy, if I go to work one day or for a couple of days and I'm not high energy, someone should see there is something different going on. We can't just be focused so much on our job or our lives or our family that they're missing the people in our circle around us. So I think with us stepping up and leaning in and using what we have, I think that we could be so much further in caring for people who really need people to care for them.
I think that's an excellent point. I think that the challenge comes when we are not in person with each other anymore. When somebody can turn off their camera on a Zoom screen in a meeting, we don't really know if they're being high energy or if they're like working on something else at a fast and furious pace. I would love to hear more about that. Just in general, like how, if you are going to open your eyes in this new-ish way that we're working, what are some good ways to do that? Joanne, I'm putting you on the spot, but really anybody can answer.
Because this is really my lane. Because I think to be a part of diversity, equity, inclusion, you have to be intentional. I'm intentional about everything that I do. I'm intentional about who's in the room, who's on the set. And I have virtual coffee sessions with my employees. When I have that, it's very relaxed. We don't have to talk about work. It is carrying on. You can be in a meeting and not. So really leaning in to find out, how are you? But even every time with my team, the first thing I say after saying good morning or terrific Tuesday or wonderful Wednesday is, how are you? Before we talk about what's on fire, how are you? How's your family? How many of us on this call know not only our employees, but the name of their immediate family, the name of their children, the people, your employees, holidays or birthday? I'm not saying you're getting all close, but I think people want to know that you care about me. So I'm very intentional on that, following up on things that don't look right or that don't sound right. Oftentimes people will say, I knew I should have said something. Go with your gut. I go with my gut to be intentional when it comes to leaning in.
Tim, you wanted to add?
Yeah, so one of the things we do as a manufacturing organization is we start most meetings with a safety moment to remind everybody to be safe at work, regardless of the meeting. If you got a lot of people do that, we've typically added an inclusion moment as well. Let's highlight something this month to think about so that we can all think for a moment about ways we can be better inclusive, better recognize diversity, better recognize equity, better recognize these other things that we face. Those are some of the ways that I use nudges to, to highlight topics for people. And it feels like a great way, to Joanne's point, to just take a pause for a second where people, before we get into just getting after the transaction of the work, let's take a moment to be thoughtful and mindful about it.
Absolutely. Jeris, you want to add?
Yeah, and I think that's great. And I think just on the point of nudges, another example nudge. So we get diversity, equity, and inclusion nudges in our email boxes every week. And one of the ones we got recently was just, even in the Zoom environment, check in with people when you know something big might have happened or might not have happened, right? So when we go through partner elections, when we go through the, period of the year when people are getting reviewed, getting promoted, if you know someone who either made it or who maybe have been hoping for that promotion and didn't make it this year, like just check in with them, send them a note, see how they're doing, right? Like, I think that's another way in this environment we can still, build those relationships, have those points of human connection to check on people.
We've got maybe another minute. If we could just answer this one really briefly, maybe Mike, you can do this. Are there social determinants of health that just don't get the attention they should?
Yeah, I think that's actually an excellent question. And I think the answer is yes. I talk about social determinants of health. Again, we talked about earlier things like transportation, affordability of care, things like food deserts and whatnot. There are others. And again, I think it does get into the area of mental health or may have some stigma associated. So interestingly, we do see instances of like domestic abuse or violence, which sometimes doesn't always get the attention that it should, or environmental safety at home. that, people not living in a safe home environment. I mean, we have to be careful of that. Another one that's sort of interesting is the whole area of just health literacy. So not just whether you can read or write, which is obviously sensitive, but, a lot of times people get discharged from the hospital and they're given discharge instructions, and they're, sometimes they'll use medical terminology and people nod their head. Yep, I get it. And then they go home and it's clear they have no understanding of what they were told. So I think that's another area that, having someone that can help explain and really be clear to people about, questions of their healthcare and health literacy, I think is another one to look at.
Well, that's our time. There were many more questions, so I would encourage you, if you did not get your question answered or you had something for a specific panelist, please feel free to reach out via LinkedIn or their organization's website. I'm sure that any one of these lovely people would be happy to have a conversation with you. Jeris, Mike, Tim, and Joanne, thank you so much for joining me. It's been a pleasure to speak to each of you. Steve?
Thank you.
Thank you, Lydia. And to all of our speakers for such a thoughtful and dynamic conversation. I want to especially applaud those telling anecdotes about the needs of rural dwellers and the Boy Scouts building a ramp for the worker with a disability. Those are memorable. And thanks again to our sponsor, Quantum Health, and to all of you for participating today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars. I'll mention a couple. Tomorrow, Wednesday, February 16th, is our monthly virtual conference, and its title is Beyond Diversity, Bringing Substance to Inclusion and Belonging. Thursday, February 24th, we're talking about enhancing employee mental health and wellness benefits, more about something we talked about today. And finally, Tuesday, March 1st, we'll be talking about the tangible indicator of employee engagement, the way that they use their health and wellness benefits. On behalf of From Day One, thanks everyone, stay well.